So what we've seen is millions and millions of people around the world expressing their compassion, health and care workers caring for those around them, their patients, the service users caring for each other. We've seen populations volunteering in their millions to support health services, to support elderly people living alone, to support their neighbors. And actually, what we know is that that's typical of what happens in disasters, whether it's tsunami or Hurricane Katrina or 9/11 or the Halifax explosion in the First World War. Contrary to what political elites believe generally that people will behave badly in disasters. They'll riot, they'll loot, they'll steal, they'll kill each other. But in fact, as Rebecca Solnit's wonderful book, A Paradise Built in Hell, has beautifully demonstrated, the normal human reaction, the general human reaction is compassion, to care for those around us. And of course, the media highlight the cases where people don't cooperate or are selfish or do fail to adhere to what's required. But by and large, what we've seen is people adhering to the requirements to look out for each other's health, to care for each other's health. So I think compassion is the key lesson for us. And my work is focused particularly on developing high quality health and care organizations that deliver high quality care, continually improving care and compassionate care, because I believe that health and care services are at the heart of our communities. And of course, because high quality care is important for all of our well-being. But I want to say a little bit about what I mean by compassion, first of all. So if somebody is in pain, for me to be compassionate, I have to do 4 things. I have to attend to the person. And that has 2 meanings. It means to be present with them, to be here and now with them, and to give them my attention, my concentration, if you like. Nancy Klein, an author who talks a lot about relationships, uses the phrase listening with fascination, which I think is beautifully evocative. Second, I have to seek to understand the causes of their pain. And ideally, I do that by having a dialogue with them rather than by imposing my understanding. And third is, I have to have an empathic response, a feeling response, feeling their pain without being overwhelmed by it. And fourth, and the empathy gives me the motivation for the 4th element, which is helping or serving the other person. And we know a lot now from neuroscience studies in the last 20 years about the functioning of the brain using advanced techniques like functional magnetic resonance imaging, which traces blood flow in the brain. And we know that when we ask people to be empathic towards somebody in pain, to feel their pain with them, as it were, that's associated, not surprisingly, with the activation of various pain centers in the brain. But when we ask people to be compassionate to somebody in pain, with the additional component of helping, that's associated with the activation of reward centers in the brain. And that makes sense because human beings have been, almost all of us, hardwired by evolution to be compassionate, to be helpful to people in pain or distress, because evolution selected for that, because compassion is what enables us to feel safe when we're threatened, to feel a sense of connection, to feel a sense of belonging. And belonging is hugely important in human behavior. We're as likely to die from the effects of loneliness as we are from the effects of smoking, for example. But we also know a lot more now about the importance of compassion, for example, in healthcare and healthcare outcomes. So there have been hundreds of studies over recent years examining the role of compassion in healthcare. And I'd like to just show you a few highlights from this research. Most of the studies are based on what are called randomized controlled trials, which is sort of the gold standard of research in terms of healthcare outcomes, and meta-analysis, where the data from all of the published studies on a particular topic are combined to give us a picture of what research generally is telling us, rather than one particular research study or paper. So to give you some examples, the first is a randomized controlled trial of anesthetists visiting patients prior to surgery, and they either are asked to do a normal visit where they provide sedatives, or to have a visit where they are extra compassionate in their interactions, but not providing sedatives. And those compassion visits are associated with patients feeling calm, but not drowsy, whereas the normal sedative visit is associated with patients feeling drowsy, but actually not emotionally calm. And what the research shows is that the patients who receive the compassionate visit have a much lower requirement for painkillers post-surgically and a much shorter length of hospital stay. The second example is a large series of randomized controlled trials conducted in Italy and the United States of patients with an early diagnosis of lung cancer, likely to be terminal, randomly assigned either to normal early cancer care or to normal early cancer care plus early palliative care. In other words, extra compassionate care. And it was a study of quality of life, which showed indeed that patients assigned to the early palliative care condition, extra compassion, had a much better quality of life. But what was a surprise to the researchers was the finding that they lived significantly longer. And we see similar large-scale effects of clinician compassion upon patients with long-term disorders like diabetes or HIV, and large effects of clinician compassion in the treatment of mental health problems. And contrary to what many doctors and nurses believe, the evidence shows that compassion doesn't take any longer necessarily. In some of these studies, clinicians were given scripts which took only about 20 seconds or 40 seconds to go through with expressions of compassion. And what's also, I think, really important and striking is that, consistent with the neuroscience studies I mentioned earlier, we see that when clinicians are compassionate, it's protective of their health as well. So a couple of studies of general practitioners and of nurses who are asked to be extra compassionate in their interactions over a 2-week period, that revealed that their own mental health benefited. They were significantly less stressed, less anxious, less depressed. And we see cost benefits as well of huge cost benefits of compassion in healthcare organizations. And the size of the effects of compassion are truly remarkable, greater than the effects of aspirin, which is a standard treatment in heart attacks, and greater than the effects of using statins in the 5-year risk of a cardiovascular event. So what all of this research tells us is the fundamental importance of compassion in human communities, whether in society generally or in work organizations. And work organizations are, of course, just another form of human community. And I think the challenge for us and the learning for us that comes out of this last 18 months is, how do we create the conditions in work organizations where people will be compassionate towards those they interact with, those they lead, those they serve, in private sector organizations, in public sector organizations? And the answer to that question is, well, of course, that's about the culture of the organizations. It's how do we create compassionate cultures? And how do we shape culture? Well, of course, every interaction that every one of us has every day in our work organizations is an opportunity to shape the culture. How warm we are, how kind we are, how irritable we are, how aggressive we are, how cynical we are, how compassionate we are. It shapes, it nurtures, it shapes the culture of the organization, because the emotional ripples from our interactions spread out to others. We know, for example, that if we ask people to, over a 2-week period, do 2 or 3 acts of kindness, of altruism to people in their organizations every day, of course, that has a significant benefit for their own mental health. But we also see that those that they are kind to and helpful to don't merely reciprocate the act of kindness to the person who showed them the kindness. They go on to be kind and altruistic and helpful to other people as well. So the ripples of our behavior spread out in the culture of our organizations. The role of leaders in organizations, we know, is particularly powerful. We know from the last 100 years of research that leaders' behavior is particularly powerful in shaping the cultures of our organizations, our work organizations, and probably our communities in general. Because what leaders pay attention to and talk about, and what they monitor, what they reward, what they focus on, and particularly what they model in their own behavior, what they demonstrate, tells us what it is that they value. And therefore, it tells us what we should value also. So if we're to create compassionate cultures in our work organizations, then leaders must embody compassion in their leadership. And that means leaders modeling those 4 behaviors, leaders paying attention to those they lead, listening to them with fascination, leaders seeking to understand the challenges that those they lead face. And one of the, I think, striking features of modern work organizations is how many people are subject to chronic excessive workload, to work overload, to not enjoying their work, to feeling disengaged, to feeling that high levels of stress at work, whether we look at people in the teaching profession or healthcare or other public sector organizations and many private sector organizations. So leadership is about seeking to understand the challenges that those we lead face, not by imposing their own understanding from some elevated hierarchical position, but through a dialogue to learn about the challenges that those they lead face. And the third element of compassionate leadership is empathizing with those we lead, feeling with them without being overwhelmed by those feelings, because that gives them the motivation to undertake the 4th element of compassion, which is to help those we lead. And this is not some new model of leadership. We've known for the last 60, 70 years that these 4 leadership behaviors are critical to effective leadership, that we know that probably the most important skill of leaders is listening to those they lead, listening deeply and openly. And we know from all of the research evidence on leadership that probably the most important task of a leader is simply helping those they lead to do their jobs more effectively by helping to remove obstacles and helping to ensure they have the resources they need to do their jobs effectively. The right staff with the right skills, the right equipment, the right training and development. And this is, not simply an ideology of leadership that doesn't have strong research evidence behind it. We know that these behaviors result in staff feeling much more engaged. And that's hugely important because, for example, across the EU, we know that only about 20% of the workforce in the European Union feels engaged most of the time at work. 50% say stress is common. And all of this has a huge impact on productivity. The more engaged people are in jobs in the private sector, the better is the financial performance of their companies. There's improved customer care when employees are engaged and say they have a good understanding of customer needs. In organizations where staff aren't engaged, a very low percentage say they understand what customers' needs are. In organizations with high levels of engagement as a result of these leadership behaviors, we see more sales, more innovation, more profit, less turnover of staff. So compassionate leadership is really critical to effective performance. To give you another example, we've known now for about 20, 25 years from research by people around the world that these 4 leadership behaviors really make a huge difference to organizational performance. So the research of people like Ben Schneider in the United States over many years has demonstrated what they call the value chain. These leadership behaviors affect staff satisfaction and engagement. That in turn affects customer service. That in turn affects customer satisfaction, customer loyalty, and productivity and profitability. In my work in the National Health Service in the United Kingdom, I've been fortunate to be able to analyze data now that we've been accumulating over 18 years. In 2003, in England, the National Health Service introduced a national survey of staff, and that's been repeated annually ever since, so for 18 years. And over 500,000 people respond now every year to that survey. So it gives us a huge amount of data that we can analyze to understand what makes a difference to the performance of NHS organizations. And we can do the most sophisticated statistical analysis. And rather simplistically, I'll present our findings, which is that what we see is that what staff say about their leaders in relation to these behaviors predicts subsequent patient satisfaction. Staff satisfaction, as we see in the private sector, predicts patient satisfaction. Where staff have excessive workloads, chronic work overload, then we see patients subsequently reporting that they're treated with less compassion, less respect, not shown the privacy that they wish for. And in the organizations with the highest levels of staff stress, we subsequently see significantly worse care quality, worse financial performance, higher levels of staff turnover, and in the hospital sector, much higher levels of avoidable patient deaths. So compassionate leadership is critical for the performance of our organizations, and I think it's a key lesson emerging from the pandemic. But it's important, I think, to stress that this is not some sort of soft cushions, scented candles approach to leadership. I think it requires a great deal more courage and authenticity than the rather easy opt-out of command and control leadership. We just tell people what to do. I think it requires much more compassion and courage and authenticity, because our compassion is ultimately focused on everybody as leaders. It's focused on the customers we provide services for and products for. It's focused on, if we're in the public sector, on the public that we provide service for. If we're in healthcare, it's for patients and service users. So it implies a really strong focus on performance management. And it's certainly not some easy consensus way forward. I always remember, I think it was in 1991, 92 maybe, that Nelson Mandela was released from Robben Island prison after 27 years in prison. And at that time, the ANC was celebrating because they now had their leader to lead them to war against the appalling apartheid regime. But Mandela went against the vast majority of his followers, insisting on seeking a negotiated resolution and way forward, if at all possible, despite the terrible atrocities that were being committed by the apartheid regime at that time. For example, the murder of Steve Biko in prison. But now Mandela had the incredible courage to, out of, I think, his greater compassion for the country as a whole and his desire to avoid a civil war, had the courage to go against his followers, I think because of his compassion as a leader. And against all of the odds, he succeeded in achieving a relatively peaceful transition to a biracial South Africa. So compassionate leadership is more than simply, just agreeing with those we lead and being kind to those we lead. It's about being effective as leaders. And effective leadership means creating direction, alignment, and commitment. This is a very powerful model developed by the Center for Creative Leadership, an international organization that does much charity and pro bono work around the world. The idea is that effective leadership ensures direction, that we have a clear vision of our work and a clear set of associated goals. For example, in healthcare, the commitment to transform the health and well-being of the population, to live their lives to the fullest and to feel safe and cared for and healthy over the course of the coming years. And this is not, this is not about having a bunch of words on the website. It's the concept of a direction or a vision is that it's a beacon, if you like, that guides our decision-making day by day, hour by hour, moment by moment, and that leaders keep emphasizing as the core purpose of our teams, our organizations, our countries, indeed. And it's about alignment, ensuring that everybody's efforts are being coordinated around that inspiring purpose in our teams, between departments, between organizations. And it's about effective leadership is about creating commitment, trust, and motivation of those we lead. And if leadership is not inclusive, then it's not compassionate. I think compassion and inclusion are like two sides of the same hand. Compassion is about connection and belonging and trust. And inclusion is about connection and belonging, about not excluding people. And inclusion means everybody feeling equally included by our leadership, everybody receiving the benefit of our attending, understanding, empathizing, and helping. Inclusion, of course, and valuing diversity is a moral issue. It's also a health issue. So we know that a child excluded from her friendship group in the playground will suffer enormously. It will lead to inflammation of the central nervous system and make the child more likely to become ill. And we know from all of the research on discrimination in society that those who are discriminated against, maybe people with disabilities or people from minority ethnic groups, that over the lifespan, there are biological weathering effects or damaging effects that occur over the lifespan. We have starkly illustrated by what happened during the pandemic, that people who are disadvantaged in society or discriminated against, like people with disabilities, and people from minority ethnic groups were much more likely to die as a result of contracting the virus, whether it's Hispanic people in Chicago 10 times more likely to die after contracting the virus, or Black people in Brazil 3 or 4 times more likely to die than white people from contracting the virus. And in the health service in the United Kingdom, where I live and work, we saw hugely disproportionate effects of the virus on health service staff from minority ethnic backgrounds and people with disabilities. So inclusion is a moral issue, and it's a health issue, but it's also a performance issue. I've been studying team working for the last 35 years, and particularly in many settings, but particularly in healthcare settings. And what we've seen, whether we look at diversity in executive teams or boards or production teams in the private sector, or executive teams or primary healthcare teams or community mental health teams or breast cancer care teams in the health sector, that diverse teams with clear goals that meet regularly to review their performance and that value everyone's contribution are much more productive and much more innovative than teams that are more similar, made up of more similar people. Whether it's diversity in terms of professional background, opinion, demographic characteristics, that diversity in positive environments leads to better productivity and effectiveness and innovation. And, diversity is the reality of our universe. It's the nature of this amazing universe, the diversity of human beings, the diversity of species, the diversity of our ecosystem, the diversity of planetary system, of galaxies. The nature of our universe is diversity, and we must embrace that diversity in our lives, in our communities, in our nations, in our workplaces. Because compassion is about including everyone. And third, compassionate leadership is not compassionate if it's not collective. Compassionate leadership is not about seeking to influence people so I get more power for myself. It's about enabling everybody to feel empowered, to lead, to take responsibility, to make a difference. And we know from so much research internationally that shared leadership in teams is associated with the most effective teamwork. So we may have a hierarchical leader in the team, but her or his role is to ensure that everybody's knowledge and skills and ability and experience is brought to bear on the tasks that we face. Of course, in a crisis, it's when there's a very short time scale, it's the role of leaders to make decisions, but also then the role of leaders to take the time to review the effectiveness of that decision making. And also increasingly we know that if we're to be able to respond to the challenges we face as a species of the loss of biodiversity, of climate change, of the proliferation of nuclear weapons, we have to learn to work compassionately across boundaries. We have to always ask the question of, in our work organizations, of other teams, of other departments, of organizations in other sectors, how can we help you so that together we deliver effectively for our society? And what's really inspiring for me is I see these messages about compassionate leadership being taken up in organizations around the world and by health sectors, particularly in Wales, where I grew up. The National Health Service in Wales has committed to a 10-year strategy of developing compassionate leadership across the whole of health and social care. And they have a compass of compassionate leadership, of compassionate behaviors that they're encouraging everyone to take up across the country, and a set of behaviors that underpin compassionate leadership in healthcare. So I'm not going to go through all this, but hopefully, Carmine, we can share the slides with the wonderful people who are joining us this evening. And the second, I think the second theme that I'd like to draw out, it's what we've seen during the pandemic is how people have suffered. They've been afraid. There have been such high levels of stress. There's been so much tragedy, and that's affected people in the workplace. So the monitoring of people's workplace well-being we've been conducted has shown that stress levels have jumped by at least 10%, and in many instances much more. Many more people are becoming ill as a consequence of the stress they've experienced both during the pandemic and in their workplaces this last 18 months. And it's great to see so many workplaces putting in place interventions like mindfulness apps or resilience training or yoga or diet advice. But the underlying cause of workplace stress has not been well understood. And I want to say a little bit about how we create better work environments for all of those in our work communities around the world. I've had the privilege over the last 3 years of first co-chairing an inquiry on behalf of the United Kingdom General Medical Council, the body that oversees the work of doctors, an inquiry into the mental health and well-being of doctors. And last year, on behalf of the Royal College of Nursing Foundation, an inquiry into the mental health and well-being of nurses and midwives across the 4 UK countries. And to guide our work, we used a well-established model of the core work needs of people, which is called, it's actually called self-determination theory. But it's a well-established theory with lots of research evidence to support it. And what it tells us is that we, all of us, have 3 core work needs that need to be satisfied for us to feel well and to feel healthy and to feel intrinsically motivated. All 3 of these needs must be met. We have a need for autonomy and control, to feel that in our workplaces, we're not merely cogs in a system. We're not just human resources like, I don't know, other sorts of resources like petrol and metal. And we're human beings, and that we have some sense of that our voices are heard, that we can influence our workplaces, that we have some authority, some empowerment, and that we work in climates of justice and fairness rather than fear and blame or discrimination or favoritism or secretiveness in our work environments, and that we have control over our working conditions. We can get access to water when we need to drink. We can go to the toilet when we need to. We can get access to nutritious food when we're on night shifts. We can have influence over our work rotas and schedules, so that if we have to work shift work, that our voices are listened to as we try to manage the balance between our work lives and our home lives. All of these things affect our sense of satisfaction of the need for autonomy and control in the workplace. When we take away that autonomy and control, it damages human well-being. We know that the more demands that people have in their workplace, the more control they need, the more resources they need. And the second need, which is really powerful, is the need to belong, the need to feel that in our work organizations, our communities, our teams, we're valued and respected and cared for. Because as I said, our work organizations are just another form of human community. And the team is almost like another form of family. And the more we work in work organizations where we feel valued and where we feel a sense of connection, where we feel a sense of belonging, the better is our mental health. We found, for example, amongst doctors and nurses, that when they worked in teams that had clear goals and met regularly, that stress levels were 50% lower. And that in those organizations where more people were working in such teams, levels of errors that harmed patients and staff were significantly lower. Care quality was better. Financial performance was better. And many more patients' lives were saved than in those organizations where teamwork was not so well developed. We've been working in teams for hundreds of thousands of years. It's a form of working we're very familiar with, and it's very important for our well-being. So we must, I think, in modern organizations, work much harder to retain that eons old way of working that is core to human behavior, which gives us that sense of belonging, and develop cultures of compassion, as I've said. And third is, we have a powerful need for a sense of competence or contribution, that we want to feel that our work is making a difference. It's making a positive difference, because it gives us a sense of being effective in our environments. These needs are important in our lives generally, of course, but particularly in the workplace. And the factor that we've found in our research over many years that's most damaging to that sense of competence is people being subjected to chronic work overload. It's the number one factor in staff stress, the number one factor in staff intention to quit, and the number one factor that inhibits innovation and quality improvement. But I think in modern organizations, we treat chronic work overload as a bit like the pattern on the wallpaper or the rug that we no longer see. But we must address this issue because I think it's core to the pathology of modern organizations. And I see really inspiring examples of organizations where these things are being addressed. So some examples from the work I do in healthcare. In the last year, Northumbria Healthcare Organization, which has the lowest levels of staff stress in the English Health Service, National Health Service, introduced a Facebook page called COVID A Voice to give staff an opportunity to voice their concerns. And of course, many of them spoke up about the lack of personal protective equipment during COVID, which made them terribly afraid for their own lives. So the leadership of the organization made the decision to build a factory within a few weeks and hire local people as cutters and sewers. And they quickly produced over 2.5 million gowns and many other pieces of personal protective equipment for use within their hospital, but also across the whole of the health service. Some organizations I work in have moved away from suspensions of staff and disciplinaries to what are called restorative cultures of justice and fairness, where everybody is supported to learn from errors, eliminating over 80% of disciplinary proceedings and over 90% of suspensions, saving millions of pounds in the process. And many organizations introducing self-rostering and e-rostering in shift work. And I see lots of organizations addressing the issue of excessive workload, asking staff what rules would they get rid of. And they often find that many of those rules aren't rules at all. And what activities would they eliminate? And we hear lots of stories about staff saying, get rid of unnecessary bureaucracy, unnecessary travel to headquarters, and having to ask managerial permission all of the time. There's a model in the military of mission command that says the role of senior leaders is to advise on the overall direction, but to free people at local level to make responsible decisions about how they implement those directions. And it's about providing compassionate and supportive supervision and enabling people to learn and develop so they feel a continuing sense of growth and competence in their work. And the third theme I want to mention in terms of how we create these compassionate cultures is related in a way to what I've just been saying. So in my work, what I've seen is, I think, the pathology very much of modern organizations where we just increase the level of work on people because we're always so concerned about increasing productivity. But actually, I think we make a fundamental error in the way we approach this. So in the work I've been doing over the last 30 years, we've seen so many teams in so many sectors under pressure. And we ask the question, what happens if they stop working and take time out to reflect? And in all the studies we've done, we found that when individuals and teams and organizations take time out regularly to reflect, to review, they're much more productive, much more innovative, and people's mental health is much better. So, for example, speaking to military medical leaders in combat zones, reporting that they, in dealing with major trauma, they have 2 patient rounds a day and 1 consultant round a day, because that's the only way they can wisely and innovatively respond to the terrible challenges that they face. And those ways of working have had a huge impact on how we understand how we can manage major trauma around the world. We see executive teams that have away days are much more productive and innovative. Nurses on ward shifts in hospital that have 10 or 15 minutes at the beginning of a shift and at the end of a shift are much more productive and innovative. and so on. So we see this effect, and not just the research I've been involved with, but research teams around the world in many countries have demonstrated this effect. In fact, one meta-analysis combining the data from 49 separate published peer-reviewed studies showed that teams that do this on a regular basis are between 35 and 40% more productive. I mean, that's astonishing. There's this pathology, I think, of workload and productivity emphasis, and we spin we were like hamsters in a hamster wheel. We spin the hamster wheel, and the workload goes up, and we spin the hamster wheel faster. But what we see in reality is by stopping and taking time out on a regular basis, we work smarter, more innovatively, more productively. It makes a huge difference to performance. We're so busy, we don't have time to be. I remember last April when, it certainly for in the United Kingdom, it was a very frightening time as infection rates were climbing so rapidly. And I'm privileged to have a garden in my house where I live. And I spent quite a lot of time during that period sitting outside in nature, hearing the bird song again and watching the insects, and how nurturing and nourishing that was. And it's a truth of human behavior that we need times of stillness. We need time to reflect. We know that people taking breaks at work is really important for their productivity and their functioning and their creativity. We know that vacations are important for people when we can take them. So we must transform our teams and organizations for the future, because we spend so much of our lives in the workplace. Surely we should make these compassionate and effective communities. So to summarize, it's about creating, developing compassionate leadership and effective team working, meeting people's core needs, and ensuring we have shared vision and values and objectives in our teams and organizations, nurturing climates of reflection and innovation and learning rather than fear and blame, having frequent positive contact with each other, appreciating each other, saying thank you, caring for each other. I know you've been under pressure. How can I help you? Smiling, chatting, sharing jokes, asking how our children are, valuing diversity and difference, and managing conflict effectively. Chronic interpersonal conflicts are a disaster for teams and organizations and families and communities. But conflicts about what we should do and how we should do it are inevitable when we're seeking to improve our work, our lives, our communities. And we must approach those conflicts in a transparent, open, ethical, courageous, compassionate way. Because what that does is helps us to develop new and improved ways of doing things and build a sense of psychological safety. And we know it's about creating climates of mutual support and compassion where there's humility rather than arrogance or hubris. That we know that humility in leadership is really powerful in terms of leadership effectiveness rather than arrogance or narcissism. And that means it's not about being, seeking to get everyone to agree with me. It's having the humility to say, I don't know when we don't know, and having the humility to seek feedback as leaders. I cover all of these. I've had during the course of the pandemic, I've had the privilege of having the time and support of many people to write a book I've been longing to write, to bring together the research evidence that Carmine kindly talked about at the beginning. The book is called Compassionate Leadership, Sustaining Wisdom, Humanity, and Presence in Health and Social Care. And you can find a lot more practical advice and web resources, links to videos, questions for discussion, questionnaires. And I hope that for me, it's been a labor of love. So I hope if you access it, it will be useful. But I want to finish by emphasizing that I think the most important first step in all of this is for each of us as leaders, as individuals, to have the courage to be self-compassionate that compassion for others is grounded in our compassion for ourselves. And that means learning to be self-aware in the moment, to pay attention to ourselves, to pick up on when I'm feeling angry, anxious, inadequate, ashamed, joyful, happy, and particularly with those negative feelings, to, rather than repress them or deny them, to accept them so that we can explore and understand them and bring a caring, loving orientation towards ourselves. And I know that for many people, this idea is a little difficult. Oh, I'm here to care for other people, not to care for myself. But caring for ourselves is a powerful basis for being able to care for others, because when we do care for ourselves, we can help take intelligent action to enable ourselves to be the best person we can be, the best leader we can be. And that book there by Tara Brach, Radical Compassion, is a very good guide to self-compassion. There are many others by people like Kirsten Neff. And when we're self-compassionate, it encourages us to look after ourselves and to implement the ways to well-being. And the most important way of caring for ourselves is spending good quality time with the people we love and those who love us. It's about belonging. It's making sure that we get enough sleep. 8 hours is necessary for the 95% of people. Getting exercise, being present in the here and now rather than always lost in rumination about the past or anxieties about the future. And it's about continuing to learn and grow. And of course, as I've emphasized throughout, the benefits we derive from giving and helping others. And we must also benefit, I think, from the research that tells us how we can recover from stressful work days. And my esteemed and wonderful international colleague, Professor Sabine Sonnentag at the University of Mannheim, has been doing research for the last 20 odd years on how we can recover from stressful work days. And her research tells us about the importance of activities that enable psychological detachment. I don't know, like watching a Netflix series, or and the value of meditation and relaxation, and the value of tasks that give us a sense of mastery, maybe cooking a lovely meal or playing a sport, and the importance of, when we finish work, of having some control over our non-work time, so we don't just have another list of all tasks we have to get done before we can sleep. And as I've mentioned, work breaks are so important, proper lunch breaks without tasks. For example, we know that doctors who take the time to have lunch together, the randomized control trials show patient care quality is much better afterwards. The effects of vacations are powerful, but though they fade in a couple of weeks. And spending time in nature. Her research shows how there's a kind of hierarchy, if you like, of beneficial effects. Blue environments are the most powerful, being by lakes, sea, rivers, closely followed by green environments like hills, fields, and forests. I love the idea in Japan of forest bathing. And I feel it when I'm in the forests and woods. And then urban green environments are really beneficial. And even being outside at all under the sky is beneficial for us in terms of recovering from work. And there's a really important, what she's discovered, law, which she calls the inverse recovery law. Those who are most stressed are least likely to do these things. So self-compassion is core, I think, to our ability to be compassionate to others. Because when we connect deeply and courageously with ourselves in a caring way, we connect more deeply with the core values that give all us human beings, give our lives meaning, like wisdom and compassion and courage. And when we connect deeply with our own values, then that enables us to be more present and authentic and connect more deeply with all of those we lead and all of those we interact with. So all of this, I think, begins with having the courage to be self-compassionate. So thank you very much for giving me the privilege and huge pleasure of sharing these thoughts with you. My email address is there if you want to follow up with any questions that we don't have time to answer. And a particular personal thank you to you, Carmen, for inviting me to present today. Thank you.
Thank you very much, Michael. Thanks to you. It was an absolutely insightful and inspiring presentation and talk. I think that we can give, if you are fine with this, some time for some question from the people attending. And as well, of course, I will send the email, the contacts and links that you about your books and things to all the participants that were more than hundreds of people signing up. But unfortunately, I think that now it's a little bit more difficult to gather everyone in terms of online and in presence. But yeah, if there is someone that has got some question related to the presentation, to the talk of Michael, we can take a couple maybe. You should actually express interest. I can unmute people that would like to do this. Yeah. Okay. Now you can unmute. Glenn, would you like to do some question?
Yeah, you seen me.
Yes, you were in calm, ready to go.
I do have a question. I want to thank Michael for the talk. It was brilliant to hear. I am fortunate to work in the NHS and fortunate to see much of the